What if the very act of breathing, something you do over 20,000 times a day without thinking, gradually became your greatest struggle? Pulmonary fibrosis is a silent, progressive disease that scars the lungs from the inside out, turning every breath into a battle. Could you recognize the warning signs before it's too late? Now, before we begin, the information provided in this video is for educational and informational purposes only and is not intended as medical advice. Always consult your physician or qualified healthcare provider regarding any medical condition or treatment decisions. Pulmonary fibrosis. Pulmonary fibrosis is not just a rare lung condition, it's an underestimated global health threat affecting millions, often without early detection. According to the American Lung Association, more than 200,000 people in the United States alone are currently living with idiopathic pulmonary fibrosis, IPF, the most common and severe form of this disease. Tragically, the survival rate after diagnosis is comparable to some forms of aggressive cancer, with a median life expectancy of only 3 to 5 years if left untreated. What makes pulmonary fibrosis especially insidious is its gradual and often silent progression. Early symptoms such as shortness of breath and dry cough are frequently mistaken for aging or minor respiratory infections, delaying diagnosis until the disease has already caused irreversible lung damage. In fact, studies show that many patients see 3 or more healthcare providers before receiving a definitive diagnosis, a delay that can be deadly. Adding to the concern is the rising incidence of pulmonary fibrosis linked to environmental exposures, autoimmune diseases, and even complications from viral infections such as COVID-19. Despite advances in research, a cure remains elusive, and the disease continues to exact a heavy toll not only on patients but also on families and healthcare systems worldwide. Understanding this disease, its causes, symptoms, and management is not merely academic, it could mean the difference between life and breathlessness for thousands at risk. Signs of pulmonary fibrosis. Have you ever noticed yourself feeling unusually breathless after climbing a short flight of stairs, or struggling to catch your breath after simple tasks you once did with ease? For many patients, this is how pulmonary fibrosis first whispers its presence, quietly, subtly, and often mistaken for aging or lack of fitness. The earliest and most common sign is progressive shortness of breath, especially during exertion. This isn't the breathlessness of running or heavy lifting, it's the discomfort that comes from everyday activities like dressing, walking to the mailbox, or tidying a room. Over time, this breathlessness worsens, encroaching even on moments of rest. A persistent, dry cough is another hallmark, lingering for weeks or months, without the relief that comes from typical cough remedies. Unlike the productive cough of infections, this is a dry, hacking cough with no clear trigger or resolution. As the disease advances, more subtle yet telling signs may appear: clubbing of the fingers, where the fingertips swell and nails curve abnormally, unexplained fatigue, and occasional chest discomfort or tightness. Some patients also report unintentional weight loss, a sign of the body's increasing struggle to cope with the disease. Unfortunately, because these symptoms are gradual, they're often dismissed until lung damage has become severe and irreversible. If you or someone you know experiences ongoing breathlessness, an unexplained chronic cough, or unusual fatigue that interferes with daily life, especially if you have risk factors like smoking, environmental exposures, or a history of autoimmune disease, it's essential to seek evaluation from a healthcare professional. Early detection through lung function tests or imaging can make a significant difference in slowing disease progression and improving quality of life. Remember, when your breath speaks, listen. It could save your life. Causes of pulmonary fibrosis. Have you ever wondered why two people exposed to the same environment, breathing the same air, working the same job, can have completely different lung health outcomes? This mystery sits at the heart of pulmonary fibrosis, a disease whose exact cause remains elusive in many cases but whose risk factors are becoming increasingly clear. In nearly half of all patients, the cause is unknown, a condition called idiopathic pulmonary fibrosis, IPF. The word idiopathic means of unknown cause, and this uncertainty makes the disease particularly challenging to predict or prevent. Yet, for the other half, science points to several culprits. Environmental exposures are a significant cause. Individuals working in industries such as mining, farming, or construction inhale fine dust particles, asbestos, silica, and metal dust, all of which can trigger chronic inflammation and scarring in the lungs over time. Even domestic exposures, like prolonged contact with mold, bird droppings, or animal proteins, as seen in bird fancier's lung, have been linked to this devastating condition. Medications and medical treatments also play a role. Certain chemotherapy drugs, antibiotics like nitrofurantoin, and heart medications such as amiodarone have been associated with pulmonary toxicity leading to fibrosis. Even radiation therapy to the chest area, as used in cancer treatments, can damage lung tissue and cause scarring. Autoimmune diseases such as rheumatoid arthritis, scleroderma, and lupus are another well-recognized source. In these conditions, the body's own immune system mistakenly attacks healthy lung tissue, setting off the fibrotic process. And recently, viral infections, including severe cases of COVID-19, have been implicated in the development of post-viral pulmonary fibrosis, adding a new layer of urgency to understanding this disease. However, there are also non-modifiable risks. Genetic factors appear to make some people more susceptible. Specific gene mutations involved in lung repair mechanisms have been identified, offering clues but no clear prevention yet. While not all causes are preventable, many are. Avoiding exposure to harmful dust, using protective equipment in high-risk jobs, managing autoimmune diseases carefully, and reviewing medications regularly with a healthcare provider can reduce risk. Never ignore a lingering cough or unexplained breathlessness, especially if you have a history of environmental or occupational exposure. Early consultation and lung screening could mean catching fibrosis before irreversible scarring sets in. The lungs remember everything you breathe. Protect them wisely. Symptoms of pulmonary fibrosis. Have you ever felt winded after walking a short distance and brushed it off as being out of shape or just tired? What if that breathlessness was your lungs quietly signaling something far more serious, like the early stages of pulmonary fibrosis? Pulmonary fibrosis creeps in slowly, often disguising itself as everyday fatigue or harmless shortness of breath. The most common and earliest symptom is dyspnea, shortness of breath during exertion. At first, you may notice it only when climbing stairs or walking uphill. But as the disease silently progresses, even simple activities like dressing, bathing, or speaking at length can leave you gasping for air. Alongside breathlessness, a persistent, dry cough is another hallmark sign. This cough is usually non-productive, meaning no mucus comes up and doesn't respond to typical cough suppressants or home remedies. It may last for months, frustrating both patients and doctors alike. As fibrosis advances and lung capacity diminishes, other symptoms emerge. Many patients experience chronic fatigue and a sense of being constantly worn out, even after rest. This isn't the normal tiredness after a long day, it's a deep, unrelenting exhaustion that affects daily life. You might also notice unexplained weight loss, as the body struggles with the increasing oxygen demands. Another subtle but revealing sign is clubbing of the fingers, where the fingertips enlarge and the nails curve downward, a classic marker of chronic low oxygen levels in the blood. In more advanced cases, some patients develop chest discomfort or tightness, along with rapid, shallow breathing. These symptoms reflect the stiffening of the lungs, which makes expansion and gas exchange increasingly difficult. But here's the danger: these symptoms develop gradually and are often misattributed to aging, lack of fitness, or other common illnesses like asthma or COPD, causing critical delays in diagnosis. If you find yourself short of breath doing things that never used to challenge you, or battling a stubborn dry cough that won't resolve, don't dismiss it. Especially if you have known risk factors, such as smoking history, exposure to dust or fumes, or autoimmune conditions, seek prompt evaluation by a healthcare professional. A simple lung function test or chest scan can reveal early signs of this life-threatening disease. Listen to your lungs. When they struggle, they're trying to tell you something. Don't wait until the damage is done. If you're finding this information helpful and you care about protecting your lung health or that of a loved one, take a moment to subscribe to this channel for more medically accurate insights on serious health conditions like pulmonary fibrosis, COPD, and other chronic respiratory diseases. your awareness could make all the difference in early detection and timely treatment. And if you know someone who's been struggling with unexplained breathlessness or a lingering cough, consider sharing this video with them. Early knowledge truly can save lives. Diagnosis of pulmonary fibrosis. Have you ever visited your doctor for a persistent cough or breathlessness, only to be told it might be asthma, bronchitis, or simply aging? What if the true cause was something far more serious, like pulmonary fibrosis, hiding beneath these common symptoms? One of the greatest challenges with pulmonary fibrosis is that its symptoms mimic other, more familiar lung conditions. Because of this overlap, diagnosis is often delayed, sometimes for months or even years, until the scarring in the lungs has already become extensive and irreversible. The diagnostic journey begins with a thorough medical history and physical examination. A doctor will ask about environmental exposures like dust, chemicals, or molds, any history of autoimmune diseases, past infections, medication use, or family history of lung disease. During the examination, the doctor may detect a distinctive Velcro crackle sound in the lungs when listening with a stethoscope, one of the earliest physical clues of lung fibrosis. Pulmonary function tests, PFTs, are essential in assessing how well the lungs are working. In pulmonary fibrosis, these tests usually reveal a restrictive pattern, meaning the lungs can't fully expand, reducing oxygen intake. The most telling measurement is the diffusing capacity for carbon monoxide, DLCO, which shows how effectively the lungs transfer oxygen into the bloodstream. In fibrosis, this function is significantly impaired. Imaging studies are the cornerstone of diagnosis. A high-resolution computed tomography, HRCT, scan provides detailed images of lung tissue, revealing the hallmark honeycombing pattern of fibrosis, small cystic spaces caused by lung scarring. This scan can often distinguish pulmonary fibrosis from other lung diseases without the need for invasive testing. In some cases, if the diagnosis remains uncertain, a lung biopsy may be necessary. This involves taking a small tissue sample through surgery or less invasive procedures like bronchoscopy to examine the lung architecture under a microscope. The biopsy helps confirm the presence and type of fibrosis and can guide treatment decisions. Blood tests may also be used to rule out autoimmune conditions or infections that could mimic or cause fibrosis. But here's the real danger: many patients are misdiagnosed or undiagnosed for far too long, losing precious time when early intervention could have slowed the disease's progress. If you or someone you care for has unexplained breathlessness, a chronic dry cough, or risk factors for lung disease, insist on proper evaluation, including pulmonary function testing and an HRCT scan. Don't settle for vague explanations. Early and accurate diagnosis is key to preserving lung function and quality of life. When it comes to pulmonary fibrosis, clarity in diagnosis isn't optional, it's life-saving. Treatment plan for pulmonary fibrosis. What if you were told that while the scarring in your lungs cannot be reversed, the progression of pulmonary fibrosis could be slowed and your quality of life preserved if action is taken early and decisively? For many patients, this realization marks the beginning of a new battle, managing a disease that demands vigilance, discipline, and hope. Pulmonary fibrosis has no known cure, but there are effective treatment strategies that can slow disease progression, alleviate symptoms, and improve daily functioning. At the heart of the medical approach are antifibrotic medications such as pirfenidone and nintedanib. These drugs have been shown in clinical trials to reduce the rate of lung scarring, helping to preserve lung capacity over time. While they do not reverse existing fibrosis, they offer patients a fighting chance to slow the disease's relentless march. For patients with significant oxygen desaturation, especially during exertion, supplemental oxygen therapy becomes essential. Oxygen not only relieves shortness of breath but also protects vital organs from the damage caused by chronic low oxygen levels. Equally important is pulmonary rehabilitation, a structured program of exercise, education, and support designed to improve endurance, reduce breathlessness, and enhance overall well-being. This therapy helps patients maintain independence in daily activities and reduces hospitalizations. Some patients may also benefit from treatment of underlying conditions such as autoimmune diseases or careful adjustment of medications that could worsen lung function. In cases where gastroesophageal reflux disease, GERD, is present, controlling acid reflux may reduce further lung irritation. For those with advanced disease, a lung transplant remains the only option that can significantly extend life. While not suitable for everyone, transplantation offers a new lease on life for carefully selected candidates. In addition to medical treatment, emotional and psychological support is crucial. Chronic, progressive illnesses like pulmonary fibrosis can take a heavy mental toll, making counseling and support groups valuable parts of the treatment plan. Treatment success in pulmonary fibrosis depends not only on medications or oxygen but also on early diagnosis, consistent follow-up, and active lifestyle adjustments. Patients must work closely with their healthcare team, adhere strictly to prescribed therapies, and remain vigilant to any changes in symptoms. Remember this truth: while the disease may limit your lungs, the right treatment plan can help you reclaim control over your life. Don't delay. Every day matters in the fight against pulmonary fibrosis. Implementation of the Pulmonary Fibrosis Treatment Plan. Have you ever received important health advice, whether to exercise more, take medication, or change your habits, only to struggle with making it part of your daily life? For patients living with pulmonary fibrosis, turning a treatment plan into daily practice is just as critical as the medications themselves. Implementing a management plan for pulmonary fibrosis requires more than just filling prescriptions. It demands consistency, awareness, and proactive engagement with one's own health. The first step in successful implementation is strict adherence to prescribed medications, such as antifibrotic drugs like pirfenidone or nintedanib. These medications work best when taken exactly as directed, with dosing schedules carefully maintained to ensure steady blood levels and effectiveness. Missing doses or stopping treatment without medical guidance can allow the disease to accelerate unchecked. Oxygen therapy, if prescribed, must also become part of daily life, not just during exertion but sometimes even during rest or sleep. Patients are often reluctant at first to use supplemental oxygen, seeing it as a sign of decline, but understanding that oxygen is a tool for preserving energy and organ function is key to long-term success. Another cornerstone is participation in pulmonary rehabilitation programs, ideally 2 to 3 times per week. These sessions include supervised exercise, breathing techniques, and educational components that teach patients how to conserve energy, pace activities, and avoid exacerbating symptoms. Environmental control is essential too. Patients must avoid dust, smoke, strong fumes, and respiratory infections by staying up to date with vaccines like influenza and pneumococcal shots. Simple habits such as frequent hand washing, wearing masks in crowded places, and avoiding sit contacts become part of everyday living. Nutritional support and mental health care also play a role in successful implementation. Eating balanced meals, staying hydrated, and seeking counseling or joining support groups can help patients maintain strength and emotional resilience. Regular follow-up appointments with a pulmonologist are non-negotiable. These visits allow for the monitoring of lung function, medication side effects, and potential disease progression. Skipping checkups risks missing subtle but crucial changes that could demand an adjustment in therapy. Living well with pulmonary fibrosis means transforming your treatment plan into habit, not exception. Every medication taken, every oxygen tank used, every rehab session attended builds a shield against the disease's progression. Consistency is your strongest ally in this fight. What you do every day will determine how far and how well you can breathe tomorrow. Monitoring and follow-up. Have you ever tried fixing a leaky pipe without checking back later, only to find water spreading quietly beneath the floor? Managing pulmonary fibrosis is much the same. Even the best treatment plan can quietly fail if not watched carefully and adjusted as needed. Ongoing monitoring and regular follow-up are the backbone of effective pulmonary fibrosis management, allowing early detection of disease progression, side effects, and treatment complications before they become life-threatening. Routine follow-ups with a pulmonologist, often every 3 to 6 months, are essential. During these visits, doctors assess symptom changes, review medication adherence, and adjust treatments if needed. Patients may undergo pulmonary function tests, PFTs, regularly to measure lung capacity, oxygen exchange, and detect subtle declines before they cause noticeable symptoms. Oxygen saturation monitoring both at rest and during activity can guide decisions about supplemental oxygen use. If levels fall below critical thresholds, oxygen therapy may need to be initiated or adjusted. Additionally, high-resolution CT scans are sometimes repeated, especially if symptoms worsen, to visualize the extent of lung scarring and to rule out complications such as infections, pneumothorax, collapsed lung, or lung cancer. Monitoring isn't limited to the lungs alone. Side effects of antifibrotic medications like liver enzyme elevation or gastrointestinal disturbances must be checked through regular blood tests. Adjusting doses or switching medications may prevent unnecessary harm while preserving therapeutic benefit. Vaccination status, risk of respiratory infections, nutritional status, weight changes, and mental health are also assessed during follow-up visits because pulmonary fibrosis affects the whole person, not just the lungs. Equally important is self-monitoring at home. Patients should be educated to track their own symptoms, worsening breathlessness, increasing cough, unexpected weight loss, or fatigue should prompt an urgent medical review. When it comes to pulmonary fibrosis, silence is dangerous. Even if you feel stable, the disease may quietly progress in the background. Never skip follow-up appointments, and always report new or changing symptoms early. Remember, vigilance is survival. The more closely you and your healthcare team watch this disease, the better your chances of preserving lung function, independence, and quality of life. Prevention of pulmonary fibrosis. Have you ever thought about how many invisible threats you inhale every day, at home, at work, even outdoors? What if some of these silent exposures could scar your lungs forever, leading to a disease like pulmonary fibrosis? Prevention, though often overlooked, remains the most powerful tool we have against this unforgiving condition. While not every case of pulmonary fibrosis can be prevented, especially idiopathic forms with no clear cause, many risk factors are modifiable. Protecting lung health begins with recognizing these risks and making conscious daily choices. For those working in high-risk occupations such as mining, construction, farming, or textile manufacturing, strict use of respiratory protection equipment is essential. Wearing certified masks or respirators can reduce inhalation of harmful dusts, chemicals, and fumes that trigger chronic lung inflammation and fibrosis. Employers must also ensure proper ventilation systems and enforce workplace safety regulations. Smoking cessation is non-negotiable. Tobacco smoke not only directly damages lung tissue but also increases vulnerability to other environmental triggers and respiratory infections. Quitting smoking is one of the most effective ways to reduce the risk of lung scarring and other chronic lung diseases. Minimizing exposure to indoor pollutants like mold spores, dust mites, and pet dander is also crucial. Regular cleaning, using air purifiers, and ensuring adequate ventilation can greatly reduce these hidden risks. For those with bird or animal exposure hobbies, precautions such as proper cage cleaning, protective gear, or reducing contact may be advised to prevent hypersensitivity pneumonitis, a known cause of fibrosis. Controlling gastroesophageal reflux disease, GERD, may also help reduce microaspiration into the lungs, which some studies suggest could contribute to fibrotic changes over time. For patients with autoimmune diseases like rheumatoid arthritis or scleroderma, tight disease control under rheumatologic care may reduce the risk of secondary lung involvement. And finally, avoiding unnecessary or high-risk medications, when possible, with careful review by healthcare providers, can prevent drug-induced pulmonary toxicity. Protecting your lungs starts long before symptoms appear. Be mindful of your environment, eliminate harmful exposures, and prioritize lung health checkups, especially if you work in high-risk industries or have underlying medical conditions. Prevention is silent but powerful. It's the step you take today to ensure you can breathe freely tomorrow. Don't wait for warning signs. Safeguard your lungs now. Emerging trend insights. Have you ever wondered what breakthroughs could change the grim outlook of pulmonary fibrosis? What medical frontiers might offer new hope where none existed before? For decades, this disease was seen as irreversible and relentlessly progressive. But today, that narrative is shifting, thanks to remarkable advances and promising research. One of the most exciting emerging trends is the development of next-generation antifibrotic therapies. Unlike traditional drugs that merely slow scarring, new molecules under clinical trial are designed to reverse or repair fibrotic damage, targeting the biological pathways that lead to lung scarring at the cellular level. For example, experimental agents like PRM151, a recombinant human protein, are being studied for their potential to halt fibrosis progression more effectively and even promote healthy tissue regeneration. Another breakthrough is the rise of personalized medicine in pulmonary fibrosis treatment. Genetic and molecular profiling of patients is helping researchers identify distinct subtypes of the disease. This means that in the future, therapy could be tailored not as a one-size-fits-all approach but customized to an individual's genetic and molecular makeup, improving both effectiveness and reducing side effects. Stem cell therapy is also generating hope. Early-phase trials are investigating whether mesenchymal stem cells can reduce inflammation and possibly regenerate lung tissue. Though still experimental, this approach could revolutionize care if proven safe and effective. On the diagnostic front, AI-driven imaging analysis is being introduced into clinical practice. Artificial intelligence tools are now capable of detecting early fibrotic changes on high-resolution CT scans, changes that even seasoned radiologists may miss, potentially leading to earlier diagnosis and intervention. Let's consider a vivid example. In a recent clinical trial, patients receiving the investigational drug ziritaxestat, which targets a lipid signaling pathway implicated in fibrosis, showed reduced disease progression compared to placebo, offering a glimmer of hope for those with few remaining options. Even wearable health tech is making inroads. Portable devices now allow patients to continuously monitor their oxygen levels and breathing patterns at home. Alerts from these devices can warn both patients and doctors of subtle declines in respiratory function, triggering faster medical responses before crisis strikes. The future of pulmonary fibrosis management lies in early detection, personalized therapy, and possibly tissue regeneration. While not yet standard practice, these innovations are no longer distant dreams, they are fast approaching reality. Stay informed. Stay engaged. Tomorrow's breakthroughs may reshape how we understand and fight this disease. And if you or a loved one is affected, these emerging trends could soon offer new options and new hope. Pulmonary fibrosis is more than just a disease of the lungs, it's a silent, progressive condition that can steal breath, strength, and independence if left undetected or unmanaged. Yet, as we've explored today, this disease is no longer a mystery hidden in the shadows. We now understand its signs, causes, symptoms, and the importance of timely diagnosis. Effective treatments, though not curative, can slow its progression, improve quality of life, and offer patients valuable time and control. But knowledge alone is not enough. Action is the real cure for delay and uncertainty. If you or someone you know experiences unexplained shortness of breath, a persistent dry cough, or fatigue that cannot be explained, seek a medical evaluation immediately. Do not dismiss these symptoms as simple aging or minor illness. Insist on proper testing, pulmonary function tests, high-resolution CT scans, and expert evaluation by a pulmonologist. For those already living with pulmonary fibrosis, consistency is life-saving. Follow your treatment plan rigorously. Attend your follow-up appointments. Use prescribed medications and oxygen as directed. Engage in pulmonary rehabilitation and protect your lungs from harmful exposures. And finally, stay informed. New therapies, technologies, and breakthroughs are rapidly emerging, and they could transform the future of pulmonary fibrosis care. Here's your action step today. Share this knowledge with loved ones. Speak to your healthcare provider about your risk. Take every symptom seriously. Because in the fight against pulmonary fibrosis, early action means longer life, better breath, and greater hope. Your health, or that of someone you care about, could depend on the steps you take right now. Don't wait. Take control. Breathe easier. Live stronger. If you found this information valuable or know someone who might benefit from understanding pulmonary fibrosis better, Please take a moment to like this video and share it with others. Subscribe to our channel for more trusted medical insights, expert health tips, and detailed disease breakdowns designed to keep you and your loved ones informed and empowered. We also invite you to leave a comment, whether it's a question, a personal experience, or a topic you'd like us to cover in the future. Your voice matters and helps us create content that truly serves your health needs. Stay informed. Stay proactive. And as always, take charge of your health.